So, John, we've talked about the kind of sex that you've been having at the moment and some of the difficulties that you've been experiencing using condoms, particularly when you are the passive partner.
Yeah.
Would it be all right to just talk a bit more in detail about that now?
Yeah, that's fine.
Okay. So, how important, if we had a scale, say, of 1 to 10,
Okay.
how important do you think it is for you to be using condoms in the sex that you're having?
10 being...
10 being it's really important for me to be using condoms at the moment, and 1 being it's not very important at all for me to be using condoms.
About 5, I'd say.
Okay, so you'd say 5, so you kind of place yourself right in the middle there. Okay. Could you give me some reasons as to why sometimes it could be okay or enjoyable for you to not be using condoms?
I suppose one of the main ones is the interruption. Like if you're with someone, it's not sort of very sexy to sort of say, oh, let's use a condom. Also, it's also disrupting it. So there's obviously, when you get carried away and there's all that palaver getting it out, putting it on, and so that's the big issue. I think for me as well, it feels, I enjoy it, as odd as it may sound, I enjoy it slightly more when I know, in some respects, I know that it is unprotected. It feels maybe more intimate or more, I don't know, more horny, I suppose, when I'm with someone and not using it. Although I am aware that that does put me at risk, which is probably why it's maybe halfway between the bottom of the scale and the top of the scale.
Okay, so kind of reasons for not using condoms can be about intimacy, makes you feel more horny, the fact that it can interrupt the sex that you're having. But you've also just begun to talk as well about the other 5, which is about reasons why it might be important to use condoms. Tell me a bit more about that.
Well, I suppose the main one is infection. Obviously HIV and other STDs and stuff. That is a concern. It's hard to know how to judge it because it's like a lot of things in life. I suppose it's an element of risk involved, and you sort of try and weigh up that risk with the positives of not using them against the negatives of you not using them as well. So potentially I could get an infection. So that always weighs in your mind. I think I sort of try to put it to the back of my mind, and certainly it's not the last thing I think about when I'm actually doing it. But maybe afterwards, you worry a little bit, and you do worry. Sometimes you think to yourself, have I picked anything up that I don't know about?
So reasons why it might be important to use condoms would be that if you were, then perhaps it wouldn't weigh on your mind. There wouldn't be such a concern about sexually transmitted infections.
Yes, that's probably a good point, I suppose. I suppose if you know you're using it, I mean, the protection rate is almost, I don't think it's 100%, but it's a lot higher than obviously not using it. So yeah, you would that reassurance would be there, and you wouldn't have to worry about the concerns afterwards, thinking, oh God, has he given me something, or etc. You know.
Absolutely, you're quite right. You know, if you are using condoms, okay, it's not a 100% guarantee that you're not going to be getting an infection, but certainly it's much better protector than not using any condoms at all.
Yes, that's right.
So we've talked about importance, and let's just use the scale again, but this time let's talk about confidence. Okay,
Right.
and if 1 was I'm actually not confident at all about the possibility of changing my behaviour at the moment, and 10 was I'm really confident about it, you know, that I could use condoms all the time, where would you put yourself on that scale?
About a 3, I think.
3?
Yeah.
Okay, so that's kind of saying really that you're not that confident about being able to make change at the moment.
No, I think it's like a lot of things. There's a big difference between knowing and having the knowledge and actually doing it. It's all well and good saying, yes, I know that I could be at risk of this, and just by putting a condom on, it's all gone. But when you're in that situation and in the moment, you're carried away. As I said, it's the last thing. You don't really think about that. It's always before and after. It's never during.
But you have put yourself on a 3. It's not on a 1. It's not on a 0.
No, true. Yeah, true.
So I'm kind of wondering how it seems to be 3. There's something there.
Yes, I suppose there is something there, and there are times where I suppose I have used condoms. I suppose in some cases it's been because the other partner has insisted on it, and that's been fine, and that almost makes it easier if the other partner brings it up and you sort of think, okay, that's fine, and you don't worry so much. But sometimes you think if they don't mention it, then they don't want to use it, and you don't want to bring it up in case they don't want to have sex with you. It's silly, but
okay, so you feel like your confidence increases if somebody else would talk about using condoms?
If there was a discussion, I mean, maybe if you were in a relationship, but if you're having casual sex, for instance, it's not always, you know, a lot of conversation goes on really. You don't get to know the partner very well, so you're taking them on a very, almost not face value, but not a great deal of depth about their character, about what they want. So you sort of just weigh out the situation. If it's not mentioned, and sometimes you feel it's not the right time to make it. It's silly, but you don't think it's the right time. But if it's brought up, if they're confident about it, then it makes me feel more that yes, that's fine. We'll use. You know, I don't feel as if they're saying it because they're worried that I'm going to give them anything. It's as if they're just being precaution. They always do it, which sort of gives me almost more confidence to use the condoms.
Sure. Okay. So what we've got is a situation really where you're saying the importance is 5, your confidence is 3.
Yeah.
With those kind of figures in mind, what do you feel about being able to make change at the moment?
It's really difficult. I would like to. I think there is definitely a part of me that really says, you're being silly, you're being stupid, you should do it. But at the same time, I know sometimes when you're in the situation, it's applying that knowledge and acting on that. But I know that I would like to. It's just making sure that I have the sort of confidence to say beforehand. Maybe even before we started, that might be a good idea to say, if you knew it was going to happen. Let's say you went back to his place or whatever, and you said, just to say that I do want to use a condom, whatever. But it's really weird. It's a weird conversation to have, you know.
Sure. I mean, and you know, I can hear what you're saying, that it does feel difficult sometimes.
Yeah.
But I think, you know, what you've talked about today has been really useful, because you have said actually that you would like to move things along, you would like to make some change. And so although when we look at the numbers, they seem to be perhaps, particularly on the confidence, low, there's certainly, from what you're saying, the chances of change taking place, that you might feel more confident in using condoms.
Yes, that's right, yeah.
Yeah. Okay, thank you.
Thank you very much.